It's a really dire situation here in Brazil. Things probably slightly better than most places where I am here in Sao Paulo, but neighboring state, Santa Catarina, 400 people are waiting for intensive care beds, and growing number of people have died in the queue to wait for an intensive care bed. Similar things have happened here in Sao Paulo. It was thought that 5 people died waiting for intensive care beds over the weekend. I think more than 5 people have died in one of the towns surrounding the big city of Sao Paulo, surrounding the the city proper. It's a really, really disastrous situation here right now. And like you said, like healthcare systems across the country, on average, more than 80% full. Even in some of the richest capitals, we're seeing, basically the healthcare system pushed to breaking point.
Bolsonaro, the president, has been cavalier, to say the least, about this pandemic. Have authorities given up trying to control its spread, or are provincial authorities trying to take some measures to try and keep it under control?
Well, that's it. Right from the beginning, Mr. Bolsonaro has, downplayed the severity of the virus, first saying it was like a media invention when he was in Florida with Donald Trump, and, lots of members of his delegation actually brought the virus back into Brazil when they returned on their flight. Then it was, oh, it's just a little flu. Then it was, okay, but we need to just man up and get on with things. And now what we're seeing is the continuation of a real disconnect between him and the state and municipal authorities, increasingly at loggerheads. This seemed to take an even more drastic turn last week when Mr. Bolsonaro appeared to indirectly threaten state governors, saying that state governments that went into lockdown wouldn't receive the latest batch of emergency funding, for the emergency coronavirus funding to keep to basically make up for the shortfall in lack of employment, and to basically allow poorer families to put food on the table. The problem is, in Brazil as a country, it's a middle-income country, lots of poor people here, lots of people working in the informal economy. And when you have a president that says things like, oh, because I used to be an athlete, if I was to get the virus, it wouldn't affect me any more than having a little flu. For better or for worse, that resonates with lots of desperate people who think, right, well, we've just got to go to work and get on with things. And so that's where you see such a confusion happening, when you've got one message coming from, the president, and other messages coming from the state governors and from the mayors.
Sam, there's also talk, of course, there's a Brazil variant as much like there is a UK and South African variant. But the concern is that this could actually spread and have regional implications because Brazil is not containing it. How might this impact the region?
Well, I mean, it's not just the region; it's the entire world we have to worry about, right? Brazil is out of the region, is one of the most global economies, and it's still too early to say whether the new variant is actually more deadly in itself, but it's almost unanimously recognized that it's more contagious, because that's what variants do, right? They become more contagious because they're struggling to survive and thrive themselves. And so if it's more contagious, that means more cases, and in a country that is struggling to provide hospital beds, that means more deaths. And like I say, with Brazil, a big player in the global economy, that means that the Brazil variant could spread outside of Brazil, into the surrounding countries. Yes, into the surrounding countries in Latin America. We've seen Latin American governments on the left, like in Argentina, and on the right in Colombia, criticizing Mr. Bolsonaro's attitude. The uptake of vaccines here is still very, very low. It's around 4%. It's a country of 220 million people. There are also fears that this new variant, if it's not got under control, could spread beyond Latin America. It could spread, it's been detected in the United States, it's been detected in Britain, countries that are advancing with their vaccine uptake. But this new variant, although it doesn't seem to be more deadly, and it seems that, in fact, most of the vaccines are able to control it just as well as any other variant, or just as well as the original coronavirus, it, in fact, still presents a danger, not just for Brazil, not just for Latin America, but for the entire world.
Yeah. Sam, before we go, we noticed that former President Lula has had his convictions quashed by a judge. Are we going to see a political comeback? Does he have a shot at winning next year's election?
Well, look, it's a week is a very long time in Brazilian politics, let alone a year and a half, which is until the next election season starts. But Lula he's currently top of the opinion polls. He also has a higher rejection rate, but his rejection rate is lower than all of the other candidates and is lower than President Jair Bolsonaro's. Jair Bolsonaro came to power on a kind of political vacuum after a series of political crises, corruption crises, and economic crises in Brazil. And since then, quite frankly, things have, for most people in Brazil, especially due to COVID-19, they've just got worse. So many people in Brazil will look back on Lula's time, which was, the most prosperous time for Brazil in recent history. Millions of people lifted out of poverty, the strengthening of a new middle class, Brazil becoming a real player on the world stage. Many Brazilians are going to look back on this and think, that was a good time. And that resonates with many Brazilians. And that's most likely why he's leading the polls. But like I say, a week is a long time in Brazilian politics. He hasn't said that he'll throw his hat into the arena yet, although it's rumored and respected that he will. Let's see what happens. But he certainly, if he isn't indeed able to run and wants to run, he'll stand a thoroughly good and great chance at winning the presidency in 2022.
Great to talk, Sam. Thanks so much.
Pleasure. Thanks, Bev.